So we move to the second part of this session, which is basically understanding the terms and the descriptions that we use in anatomy. Okay. Why is it very important that you understand these terms? Because you want to be very fluent in your communication, such that you can be understood. And if you're referring to the upper arm, the left upper arm, the person knows that you're talking about this. If you're saying that it is located medial to a particular organ, then the person knows what you're talking to, what you're talking about. So it's very important to understand these terms, because these terms are used in describing position, planes, movements, laterality, and then also relations between structures. When we talk about relations between structures, we are basically meaning whether one structure is above the other or below the other. Is it medial or is it lateral? Which side is it? When we say medial, what does it mean? When we say lateral, what does it mean? Or if we say it lies along the midline, what do we mean? Or lies ventral, dorsally, anteriorly, spirally, posteriorly. Okay, what do these terms all mean? When we say spinate, abduct, adduction, what are these terms meaning? That's why it is very important to know these terms. Okay, so they help us to know all the body parts in relation to the other. Okay, well, that's very important. So the starting point in understanding anatomical descriptions or terms is understanding what we can call the anatomical position. This is the reference point when you are describing any body part. The point here is that for you to say that a particular structure is a lateral or medial to a particular organ, it means that that body part, or the body part that you're referring to, should be in the position that it's supposed to be in, if I can say that. So here we are saying that all the descriptions that you have in anatomy should basically be that you're actually referring to a body that is in an anatomical position. So you can see this image here. This is what you call anatomical position. What are the features of this body? The person is standing upright. Okay, that is one. The hands are on the side, that is two. And the palms are facing forward, that is three. And the legs are actually close, that is four. Close and parallel, that is four. Okay, that's what we want. So when you're describing any part, we are assuming that the person or the body that you're describing is in this position. Okay, so that is what we term as the anatomical position. So for all descriptions, whether anterior, posterior, we are not talking about a person who is lying on the side. Don't think about a person who is upside down. No, the person is like that. That's what is very important. Okay, so the meaning, therefore, is that for a person who is standing in an anatomical position in front of you, their left hand side will be on your right hand side. Their right hand side will be on your left hand side. That's the whole point. So you're looking at the person directly like this. So that is the implication. So that is very important in a number of clinical scenarios. Okay, so let's look at these terms, these anatomical terms. These terms tell us about the position of one organ in relation to the other, or basically the position of one body part in relation to the other. Okay, that is the meaning of the word relative positions. Okay, so or anatomical positional terms. So we start with what we call superior. When we talk about superior, it means that the part is above what you're describing. Okay, so here we can say that the head is superior to the neck. The head is above the neck. That's what it means. The thorax is above the abdomen. Okay, that's the meaning there. So we say that the thorax is superior to the abdomen. That's what we mean by the word superior. The opposite is inferior. So here we can say that the abdomen is inferior to the thorax. Okay, and then we talk about the word anterior. We can use the word ventral to mean anterior. So here we are saying that if you have this, if this is a body part, and then this is also a body part. So this which is close up here is anterior, and the part below is posterior. Okay, so here we're basically saying that the eyes are anterior to the brain. Okay, now that's the example that you first reach the eyes before you go to the brain in this direction. So meaning that if let us draw the head like this, so that is the head. The person is facing that side, right? So this side is anterior, this side is posterior. Behind means posterior. In front means anterior. Okay, so so here the example we are giving here is that the pharynx is posterior to the oral cavity. Then we move to the terms medial and lateral. We shall look at these terms together. Medial is in reference to the midline. We can call this the median line. This red line that you see here, that is the midline or the median line. So the part which is closer to this line, we say that part is medial. The part which is far away from that midline is lateral. Okay, so that therefore means the nose is closer the midline. The nose is closer to the midline in comparison to the eyes. Okay, so the eyes are more away from the midline compared to the nose. And then we move to what we call bilateral. Here we are meaning structured, paired structures, the structures that are on either side of the body. Okay, so you have two ears, that is bilateral, upper limbs, two, legs, the same thing. Okay, so if we are saying that you have a problem in moving the joints, this joint here and also this joint, we can describe that as a bilateral joint problem, and then we specify the joint, meaning that both joints are actually affected if we say bilateral. But if we say ipsilateral, it means we are looking at two body parts that are on the same side of the body. That is what you call ipsilateral. And then contralateral, it means opposite side. Okay, so the injury can be on the right leg and affects the left leg. Okay, proximal. The word proximal, you can see it here, and we are describing it together with the word distal. In here, we are basically emphasizing the the location of a particular part in relation from the reference point, in relation to the reference point. Okay, so for example, if we are talking about your palm is far away from the shoulder. Okay, so this palm is distal compared to your shoulder. So your shoulder is proximal to the main trunk. It's basically part of the main trunk. Okay, so the part which is far away is distal. The part which is closer is proximal. Okay, and I think that is where the English word proximity comes from. Okay, so we are saying that the elbow is proximal to the wrist. Okay, so the elbow is closer to the what? To the wrist. And then distal, it is when more away from the main trunk. Okay, and then we have superficial and the deep. This also move together. Something superficial is on the surface, and then something which is deep is you have to cut through to reach that part. Okay, so internal organs are deep, and then the skin and some muscles are basically superficial. Okay, we can still have some superficial muscles and then also deep muscles. Something which is peripheral is something that is outward, away, away from the main trunk. Okay, so that's the, for example, we have what you call peripheral nerves. Remember, I have the central nervous system and the peripheral nervous system. So the nerves that move away from the central nervous system are the ones that we call the peripheral nerves. Okay.